How many syringes of Radiesse for my nasolabial folds would I need? I hate my nasolabial folds. I want a facelift, but I'm not in the position to get one at this time. I thought in the meantime I could get Radiesse for my nasolabial folds, but needed to know how many syringes I would need, so I could understand what kind of price I would be looking at.
Thank you for your question. You state in your question that you hate your nasolabial folds and that you are aware that you need a facelift, but you're not in a position to have one at this time. And so you want to know how many syringes of Radiesse you need to address your nasolabial folds and some basic related questions. Well, certainly I can address your concerns. I'm a cosmetic oculofacial plastic surgeon. I'm also a board-certified cosmetic surgeon, and I do a lot of facial rejuvenation surgery. In fact, I wrote a book about this many years ago, and so being in practice in Manhattan and Long Island for over 20 years, I have certainly a wide range of experience for people like yourself who come to our practice. So one of the first things that came to mind when I read your question was, how did you draw the conclusion that Radiesse would be the ideal treatment for you? Now, in some situations, it's because a doctor may have recommended it to you, or is it because you may have read that Radiesse lasts fairly long? Well, when we determine the type of fillers that we use, we also take a step back to help our patients understand what those fillers can and cannot do. It's interesting. A lot of people will focus on the nasolabial folds as an area where they really don't like, and they kind of miss the picture of the area around the nasolabial folds. Basically, what we're dealing with as we get older is two issues. One is volume loss. That means there's bone, muscle, and fat that diminishes as we get older. And the nasolabial folds can become more prominent relative to the surrounding volume loss. So that's another way to look at this. In addition, there is descent. And as you have stated in your question, you understand you do need a facelift. Now, there are other options, and I always try to educate my patients, and we sit together with the mirror, and I'll put their pictures up on a screen to give them a perspective on the improvement of the area that bothers them versus a global improvement. So sometimes basically what I'm saying is the patients will miss the forest for the trees. And what we'll do is maybe offer an option that may be more practical and give a more global improvement. Now these options include volume in the cheeks and fillers and combinations of fillers such as Restylane and Juvederm Voluma, as well as the use of platelet-rich plasma. We also perform a procedure called a Y-lift. And for many people who are in a position like yourself, the Y-lift, which is this method developed by my friend and colleague, Dr. Trokel, who came up with this idea and method of applying on average somewhere between 14 to 17 syringes of a thick hyaluronic acid filler like Juvederm or Voluma into various structural areas of the face to create a kind of a lifting effect that is comparable to a facelift. And it does have long-term benefit, and we do offer that in our practice. So that, the point of me mentioning that is that there are options that you can consider while you are getting maybe the funds or the time together to have a surgical facelift. I would suggest that when you think about volume in terms of a material like Radiesse, it's also important to understand the volume that each syringe has. So syringes typically contain like 1 cc or 1 milliliter, and that's the equivalent of like a baby teaspoon. And so it's very, very small. And what we always want to emphasize to our patients is syringes are expensive, and you want to use them intelligently and get the maximal impact. So in someone like yourself, I may suggest to you to treat the submalar area or the cheek area rather than the nasolabial folds to try to get some balance. One of the things that I often tell our patients is as we get older, the face comes down and the jowls occur and there's a squaring off. When we're younger, there's a kind of a heart shape to the face. And so that again is similar to as what I described the Y-lift being. So I think that instead of getting so narrow about the radiesse, you have to be very clear about what your desired outcome is and what will actually happen. A lot of times people come to us who have had fillers done elsewhere and they'll say, I got X number of fillers into the nasolabial folds and I still have them. And what I try to educate my patients about is that we can't erase these lines. We can soften them. And it's always better to look at the big picture and then try to integrate everything and come up with a plan that really provides you with the best value for the amount of money and time you're investing, as well as getting a more global result. Remember, when people look at you, they see the big picture. When we look at ourselves, we look at a small area and we magnify that. So I hope that was helpful. I wish you the best of luck, and thank you for your question.